So good morning again. I'm David Hudson from Clark County Public Health, and thanks for having us today. We're going to give you a brief overview of our work and an update since we presented to you last year.
And I'm Joy Lyons from ESD 112. Thank you for having us again.
And I'm Leanne Reed, also from ESD 112.
All right, so we're going to jump right in. Prevent Coalition is housed at the ESD 112, and we've been serving Clark County since 2003. We are comprised of parents, youth, school staff, business owners, medical professionals, law enforcement, government workers, faith-based organizations, and more. The community members and organizations work across our county to increase community collaboration and reduce youth substance abuse in Clark County. Prevent is funded through state and federal grants to prevent youth alcohol use, youth opioid use, youth marijuana use, and tobacco. So we have various grants that serve and work to prevent the use of all of those substances. The most important aspect of our first slide, which we need to move forward, there we go, is that our work, we believe that our work is the responsibility of our entire community. Keeping kids safe and substance-free lives within all sectors. There we go. And we know that parents alone can't be the only primary person keeping our kids safe and healthy. We need our law enforcement, we need our schools, and we all work together. Yes, absolutely. Let's move to the next. Can you do the slides for me? I realize it's probably easier to have help with that. So the reason we do this work is because research shows that connected and supported communities are safer and healthier. We focus on the environment where our kids are growing up, and we address the policies and systems within all of the sectors that I mentioned earlier. For example, we work with schools to address the policies around substances, and we also look at culture. We work with our law enforcement partners to decrease access to prescription drugs. We do this work with very little staff and a whole lot of community participation and engagement. Prevent does not provide direct service, although we do partner with many organizations that do, and ESD 112 provides many direct services, but the coalition does not. We work closely with Clark County Public Health because we both approach this work with a public health model. And we're here today to share examples of our successes from the past year. And the most important reason we're here is because we ask for you to support our mission and our cause, and we know many of you do. As leaders in our community, you influence our policies and our systems, and we hope to be an educational resource to you so that we can be an ally and keep our community safe. Prevent works collaboratively with 5 other substance abuse prevention coalitions throughout our county, and this slide shows the logos and somewhat of the location of those coalitions. I'd like to point out Connect Evergreen is right down at the bottom. That's our newest drug-free communities coalition, and they recently partnered with many stakeholders in our community to plan and implement a youth conference at Clark College. We had almost 200 students attend, and it was middle and high school, and it was called Teens Care 2. This was our 5th conference that we've held over the last 8 years. And the conference, students attended sessions on mental health, yoga, leadership, and being an ally in diverse times.
This slide demonstrates how effective prevention is and how cost efficient it is. The return on investment is an outstanding 18 to 1, and that's based on school-based programs. Other areas can show different, but that's when you're implemented within the schools. As we partner with ESD, we focused on that. This clearly shows why investing in prevention programs and strategy is one of the best and smartest fiscal decisions that a community can make.
So one thing I want to point out is that I previously worked at the Department of Health in Olympia before I came to Clark County, and the Prevent Coalition was known as leaders in the state related to this work. And last year, they received an exemplary award from the Department of Health for their coalition work. So I think it's important to point that out. As Joyce said earlier, this is all about partnerships, and we're really honored to partner with ESD 112 on this work. And our role really is to be the data experts. So we help the coalitions with data collection, data analysis, and reporting. And the reason that we're focused on policy, systems, and environmental change is that we know that it affects everyone in that environment. Let's say, for example, a school. It's most cost effective compared to programmatic or educational work, and it's the most sustainable over time.
One of the ways that we partnership with that rich and expertise that Clark County Public Health has in data is we did an in-depth needs assessment of our county and looking at where are the needs, where can we address substance abuse and be most effective. So we did an in-depth needs assessment using healthy youth data, OSPI data, community service, survey data, and we created the needs assessment. And based off that needs assessment, this year we had in-depth planning on a strategic plan. Our work is very organized, focused, and our approach is very direct and planned. We don't just go out and do various activities. They are strategically planned to address the problem that contributes to youth substance abuse. And we created, utilizing the data that we work with Clark County Public Health for, we completed a 5-year strategic plan. And this plan is going to tell us exactly the how, where, and when we're going to implement activities in our community to address the problem behaviors that are related to youth substance abuse. That strategic plan is available on our website, and you can see the different activities that will be implemented there.
This slide shows photos from our drug take-back events that are held throughout the county twice a year. And many of you know about these events. We've kind of presented lots of information about our drug take-back events, which we wouldn't be able to do without the participation and partnership of our law enforcement, other coalitions, healthcare organizations, and Clark County Public Health. But did you know that when young people access and misuse prescription drugs, the most common place that they get them is from their own medicine cabinet at home, or their families or neighbors in their medicine cabinets? So that is why we do these take-back events. We know that we're decreasing that access and the supply, and we're encouraging the public to safely dispose of their medications instead of flushing them down the toilet or throwing them away in the garbage where they can get stolen. We are working with Clark County Public Health to have an environmentally safe way to dispose, and then also a safe way to reduce access for youth. So this slide shows the progression over time since our first event in 2010, the number of participants and how many pounds of medication. And I'd love to draw your attention to, as of our last event in April 28th, 2018, the total drugs collected over this 8-year span is 23,000 pounds, 830 pounds of drugs. And so we do collect the medicines and the drugs, and we weigh them, and we're measuring our outcomes.
Before we leave that, and before we leave this topic, if you could let us know when and where the next drug take-backs will be.
I would love to tell you. And I meant to put the flyer up on the slideshow, but I didn't get to it. So the next drug take-back event will be October 27th at 4 locations throughout Clark County. It'll be in Battleground. It'll be in the Peace Health location on 33rd Avenue or Street in downtown Vancouver. It'll be at the Kaiser out in Cascade Park. And it will be, I'm forgetting one, I don't know what, I'll find the flyer for you and let you know. But it's October 27th. It's a national event, so it's promoted through the DEA, Drug Enforcement Agency. And so there's a lot of promotion, and it's a collaborative national event that we participate in.
Speaking of that, when does legislation take effect for drug Takeback?
That's a good question. I'm not, so do you have the answer to that?
I have a little bit of information. I did, I had a feeling you were going to ask about that today. So I looked it up, and so the Takeback law went into effect in March. And so Department of Health is currently writing rules for how to implement that law. And so it's not really effective yet. And so there's a time frame, and it's looking like it's going to be several months until those rules are developed.
So, coming from the Department of Health, are they going to ask you if we have input on making them rules?
Yes.
I would
Yes,
hope so.
there is opportunity for input and public input. I think they actually had a meeting this week,
Okay.
and you can weigh in. Mm-hmm.
And I suspect the rules are going to be modeled after the ordinances that had already passed. Remember, we had spoken to several counties that passed ordinances around, so it's going to be pretty similar to that.
Yeah. Great.
I think that's an understatement. That was a huge victory.
It was, absolutely. So yes, thanks for asking. We're very happy about that. Okay, so this slide, it shows a brand new campaign, hot off the press, from Prevent, that has been created by local stakeholders. It's a partnership with Prevent as well as Clark County Public Health and 21 other entities, their coalitions, their representatives all over, have convened over this last year and created an education campaign around locking prescription pain medicines. So it's called Locks Save Lives, and it is still being developed, and our plan will be to implement a pilot of this project at the April Takeback event in 2019. The purpose of this campaign is to change behavior. And so we will have some kind of locking device that will be purchased through the grant that we'll hand out for free to the public if they commit to locking the prescription medicines. And the focus audience is parents and grandparents of young people, of kids in 6th through 12th grade, so that we're really restricting that access of medicines that are in the home. So we're focusing on disposal and also safe storage. That's what this campaign is. So my last slide is sharing about our websites and our educational resources. We have 2 websites that are used extensively in the community. They're new, they're branded, they're fresh. The Youth Now website, oh, that's where the...
Yeah, your slide does have...
so it's supposed to say youthnow.me, which is the web address, but for some reason it looks like a little picture. But we can get that information. You've got it printed, perfect. So it's a hot link to the website. So Youth Now is the website that's for youth. It was developed by youth. It's for youth, and we want our youth in our community to access this resource. We know that having youth be a part of the development encourages them to actually use it. And so an example of something that we have on that Youth Now website is it's a toolkit called Friend to Friend. And our youth county prevention group called STACIA, if you've heard that acronym, they created this toolkit. And it's all about how to talk to your friends if you're concerned that they might be using marijuana. Talking points, what do you do? How do you address it with your peers? And it's really awesome. And I really encourage you to take a look at that website and look at the materials that our students created. And then our communications team at ESD created all the graphics. The Prevent website is for our adult audiences, and that I would encourage you as well. We post current research, we post all of our strategic plans, our action plans, and any events. We have a calendar where if you're curious about anything you heard in the community, you can go right to our calendar and find out where it is. We keep it updated, newsletters, everything is there. So anytime you're curious about what we're up to, I encourage you to check out our websites.
And the youth website is really done by youth for youth, because we know that they're going to resonate much more than if it's a general campaign developed by adults.
Yeah, thanks.
Before we leave this slide, just a question about the photo on the left-hand side. Can you see it? Just the backs.
In the blue.
Yes, thank you. So that really focuses, it looks like, on marijuana, and we only have part of that website in the slide. Does it focus on any other?
Yes.
It does.
The whole page is created to, like, it's mobile friendly too, so you can just cursor down and it's marijuana, alcohol, tobacco, prescriptions.
I just wanted to make sure that it did in fact include the range of things that's really dangerous for use.
Yes, they sure do. Thank you for asking.
So this slide just shows you a clip of some larger state-developed campaigns, and that's significant because the state has much deeper resources for developing, marketing, and producing these campaigns. This campaign here was developed by the Department of Health, specifically for youth, underage youth marijuana use. But it is targeted to parents and caregivers of youth. And it really empowers the parents that we often think that peer pressure is one of the, it is large, but it is not the only influence in a youth's life. And this really encourages the parents to, you have a major influence in your life. And even in my days as a PI, that was one of the most significant things kids told me they didn't want to let down their parents. And this reminds us as parents and caregivers that you have an impact. And it's short little clips and banners that are on newsprint, social media, and in theaters. And one of them is simple, just talk with your kids and set boundaries. Simple little reminders like that can start a conversation. You can roll to the next one. The next one is, again, developed by the Washington State Healthcare Authority, and it's an opioid prevention campaign, and it empowers individuals. But this is a nationwide epidemic, but you as an individual can make a difference. With just one conversation, one act of courage, you can make a difference. And as I say, it was in newsprint, theater ads, to encourage individuals to get involved in prevention at a wide level. We were able to bring that into Clark County, and each of these campaigns were promoted in the Columbian and Reflector. We also have theater spots in the Liberty Theater, Camas, Keegan's, Vancouver, Regal's, Battleground Cinema, and both the Cinetopias here in town. So both of these were promoted in May and June, and also social platforms carried them such as Instagram, Facebook, and Twitter.
So Joy talked earlier about the partnership with Clark County Public Health and the Parkour Coalition, and this is another example. Last spring, Adiba Ali, one of our epidemiologists, participated in this panel discussion. And the reason we did this was that we went out to the community and sought their input, and what we heard is they wanted an expert panel to start a conversation around opioid use. So this discussion included talking about the signs of abuse and misuse, and also the access points, which we've talked about previously. And it was a really good opportunity to engage not only our partners, but also the community in a discussion around opioid use. And one of the things that was really great about this panel discussion is we had a student moderator. And we all know that not only do students listen to other students, but adults listen to students when it's issues that affect youth.
So how many people attended this? Who was invited?
We had about 30 community members that were in the audience. We did put out a press release. We for our quarterly coalition meetings, we focus on either a panel or an educational event, and so everyone is invited. We try to get it in the paper. We work hard to make sure it's promoted, and for this particular one, there were a lot of school staff there. We did have some elected officials and had a conversation around opioids and just decreasing access for youth.
It'd be great to try to get him in. Of course, I know that's what you're trying to do by advertising, but it sounds to me like you have a pretty good panel and you don't want that to go to waste.
Absolutely, yeah. We're always looking at strategies to get the word out, and we actually just were able to add another communications person to our coalition who agreed to help promote our activities. So,
From the youth's perspective, I mean, majority, I could be wrong, but I'll say the majority of adults get the opioids through some accident or, prescription, so then that's kind of the gateway to it. Youth, is it not necessarily that, but is it the curiosity, or is it at mom's and dad's medicine cabinet, so it's there, so let's try it out, or what's the gateway to youth?
Well, yeah, that's one example, just in the home, like we talked about before, but sometimes it is a prescription. So if they break an arm or a leg and they get a prescription, sometimes that's where it starts. I don't know if you guys want to add to any other access for you.
I think those are the two primary access.
Okay.
Misuse is what we're hearing, what we're seeing day to day is the misuse of it when it's not a prescription is access to in somebody's home medicine cabinet, be it grandparent, friend, parent.
And I would think that probably there's a talk among those who have used this, and they're told, oh, you should try this, you really feel good.
Yeah.
You know, so it's not just looking at the bottle and saying, yeah, let me see what this is.
It's
This
that
is
peer,
like-
peer
No,
pressure.
they know, yeah, they've been told by somebody that
Yeah.
this is a feel-good thing.
Yeah.
And we know that student athletes are at risk
Oh,
for injury
Oh, yes.
and then getting prescribed, and so there's
Yes.
so many strategies. Prevent isn't actively engaged in prescriber education because it's not we
Yeah,
can't do it all.
yeah.
But that is there's a whole other group doing that.
Yeah.
So yeah.
With the school district, are you involved with coaches and saying, hey, if you have a student that you know or a student athlete that has an injury?
Yes, we have staff in many of our schools, and they are that person that connects with school staff, and so that is information that they share through newsletters or through outreach. It depends on the school and the relationships, but very good question.
So I want to talk a little bit about, this is not an advocacy for opioid addiction. Let me start by saying that. There are reasons that legitimate pain is treated, and some of treatment of pain can be life-saving because the effects of excessive pain, trauma patients, and so on and so forth. There is an appropriate time for medication for pain relief. And I think what we've seen happen over the years is excessive use and then abuse. So I worry a little bit that we're going to leave an impression that there's no appropriate time to treat pain. And I don't want to overemphasize that, but there is a balance in this. And people who need pain medication, even older people, are getting very hesitant about taking medication. And to be cautious about it is healthy, but there are times it's appropriate to treat pain. I don't know how to balance that message. What we do know is that opioids, because of how they react on the body, has become a very worrisome, abusive situation. And we can save lives and other segue drug introduction by talking about it. So it's the balance in life that is the hard part, and youth have a harder time balancing their lives. So this is really important.
Yeah.
Thank you. Absolutely. I think we just have a couple more slides. open up for questions.
This is the year of the Healthy Youth Survey. Youth will be taking that in October. We'll get the data back in March, and I will be quickly turning to our expertise to help us really understand that and understand what that means and make it real world and show the trends. Seeing the trends over the years with this is a powerful tool in looking at what our youth are seeing. One of the areas I know in particular in the marijuana work is we're going to be really paying attention to perception of harm, because that has been declining in youth. And historically, research shows us when perception of harm declines, use increases. So we have some really interesting things that we are going to be partnering with Park County Public Health to look at and really understand our community. And again, continue to understand that strategic planning and what we need to do to be effective in building strong youth that are resilient and healthy and thriving.
Do you work with schools when that?
Mm-hmm.
And I say this, at least in Hawkinson a couple of times, at least once, it was put, the kids took the tests, and it was kind of mixed or really close to when they do their statewide testing. So they were so sick of tests anyway, that it didn't mean much, it's just like, so hopefully it's some other time.
The OSPI actually has a week scheduled.
Oh,
So that comes from, there's periods of time when they can be taken. So going forward, just in communicating with you guys about drug Takeback, what type of research is on our website, keeping a balance. These are all things we want to continue to have a conversation with. I really thank you for your time, and I hope that it isn't just a once-a-year update, but that we can be your go-to. You guys use that webpage and see what we're doing for our quarterly coalition meetings. We'd love to see you there. We'd love to share the minutes with you. You make a big influence, and you're going to be part of the decisions made for our community. And we want to work together with you to create a healthy community. I'm really excited about what youth are doing. We have nationally trained youth that are coming back into our community and teaching leadership to other youth. We have the station meeting that's taking our cannabis conversations and taking it to other youth. We have youth leading our quarterly meetings, and this is our future. And we want to be connectors with you, with those youth, and with what's happening with prevention science. So we look forward to working with you at Park County Public Health in this next coming year.
So this year, the Youth Commission with this station too is really focusing on mental health issues. So hopefully, the two will come together anyway, but hopefully that, we'll bring them together.
Yeah. Another opportunity for collaboration.
Yeah. And I think I'm pretty excited about it. Yeah. This will be a great year. Okay, thank you very much. Thanks for all your work.
Thank you.
Thank you.